Okay, now I'm going to continue by extending the incision, going caudal. So try to stay in the middle. And again, you should have already opened up so you can see how deep you need to make the incision. Straight down the middle. Now, you're going to want to go back up and make sure you're in. And again, I still need to kind of clean it up. Still have a little bit of meat here. Now, that's the breastbone. I should be dead center of the sternum. Again, I'm into the body wall. You can see muscle here. Further down. And again, there's my liver. You want to make sure. Now, you're going to go around the umbilical cord. You have to make an incision around the umbilical cord. And again, try not to go too deep. You want to leave the umbilical cord attached. Leave the umbilical cord attached. And I'm going to go to the opposite side. Again, you don't have to make it too wide. Oop. Okay, and I'm in the body wall. All right, go to the other side, kind of clean it up a little bit. Now, at this point, I'm going to stop, and I'm going to go back up to here, because I'm going to want to make an incision right up here. All right, here we go. So, I want to go right about a little bit underneath the armpit, right here, over to the other side, and I'm going to make a flap, and that's what this flap is going to be. Okay, and again, I'm in. There's my ribs. And then I'm going to come down under the umbilical cord, and moving away from the umbilical cord, I'm going to finish the flap lower down, straight out. Oop, I got an intestine there. Again, I'm still attached, so I got to do a little bit more work up here. Small strokes. Okay. Small strokes. And if you want, you can change instruments, and I can pick it up with the scissors and do a little snip, little snip, little snip. Now I have a wall. I have a flap. I'm going to go to the other side, and straight across from the other side, from the hip, I'm going to do the same thing. I'm going to come across. Okay, now I've got to crack the rib cage. Okay, now you got to be careful because you have organs in here. All right, so from here, my ribs are up here. You can feel the chest plate. Okay, I'm going to open him up a little bit more. Got to be careful. You might have a few ribs in there. Across here. Now, once I've gotten him this far, what I have to do is I have to crack his rib cage. So, you can use your surgical scissors or you can use bone scissors. Whatever you use, you're going to want to make sure when you put it in that you lift up, because otherwise you'll puncture the heart. So up the middle he goes, and I'm just going to crack. Up a little bit more, and I'm just going to crack. And try to stay in the middle. Try to stay in the middle as much as possible. Crack. And a little bit more and crack. Now, if you want to make sure your incision is through, take your surgical scissors and see how well you got it done. And now, yep, I'm pretty good. Now, there's my heart. Okay, my lungs are going to be in here too. So now I've got to kind of pull him apart. You got to be careful. Okay, you're going to kind of want to pull him apart a little bit. Be careful because you're going to need some of these veins and arteries. Okay. All right, now the heart sits in a sac, and so do the liver, so do the lungs. So you're going to have to remove those sacs, kind of tidy it up a little bit. Now, at this point, if you've got a boy pig, you're going to go directly around to where this is kind of flopping in the middle. All right. If you have a girl pig, you want to make like a Y incision, okay? Because this whole flap is going to fall down. So at this point, if you got a boy, go around the umbilical cord, because this part is going to be the penis. If you have a girl pig, straight down. Because this is your urinary bladder. And again, careful with your incisions. And I'm going to go ahead and use some surgical scissors at this point, so I don't make sure I don't take. Oh, there's an artery there, so be careful. Kind of nip it up. Again, kind of nip it up. Lift it up if you have to. Get that out of the way. Now, this is a vein, and you're going to have to nip it so that you can bring down. Okay? Now, at this point, you will be looking at your interior.